In New South Wales, all businesses must comply with work, health and safety laws to provide a safe environment for workers and others in the workplace. This means doing what you reasonably can to make sure the workplace is healthy and safe by eliminating physical and psychosocial hazards and risks in the first instance, then minimising any that cannot be eliminated. Work-related violence and aggression towards hospital workers is unfortunately common. It can include verbal abuse, physical assaults and harassment, and it can impact the well-being of healthcare professionals and compromise patient safety. Work-related violence and aggression can be eliminated or minimised by using the principles of work design.
From a work health and safety perspective, work design is a methodical process which helps you understand your work context and then implement improvements to eliminate or minimise work, health and safety risks to your workers. This includes designing or redesigning the workplace and systems to be healthy and safe. By doing so, you can effectively eliminate or minimise hazards and risks so workers are not exposed to harm. To do this successfully, you firstly need to understand your work context. Your work context includes the organisational structure, physical work environment, along with the job roles, demands, tasks, and skill sets of workers at all levels within the organisation. Once you have captured your work context, you can analyse and identify any hazards or risks that may exist for your workers in consultation with them. The next step includes implementing control measures to eliminate or minimise the identified risks to your workers, along with a process to monitor and review these controls. It is imperative to ensure that genuine consultation with workers occurs when applying work design principles. This means involving the workers who are doing the work and having honest conversations about how work is truly done, rather than how work is perceived or documented. By doing this, you gain key insights into the hazards and risks within the work environment and can identify practical ways to address this from the workers directly involved. It isn't necessary to budget for capital works to achieve good work design. You can make work design changes with little to no monetary cost and minimal changes to the physical environment by ensuring workers are included in the process. Let's explore how good work design can be applied to help keep workers safe. Role clarity and teamwork. Workers need to know who's responsible for what. For example, emergency department clinical staff and security guards must each know their roles when trying to de-escalate a patient. This helps prevent abuse and violence from the patient, but also reduces frustration and conflict between workers. Job demands. Analysing role or task overlap and adjusting accordingly. Ensuring that workloads are manageable and realistic and staffing ratios and skill mix are adequate. This minimises workload pressures, stress and frustration. Task allocation. Ensuring that tasks are distributed fairly, preventing burnout among workers.
Communication. At staff safety huddles or handover at the beginning of shifts, make sure communication is open and encouraged so staff can ask questions and prevent misunderstandings. Ensuring communication with senior leaders is streamlined and enables workers to raise health and safety concerns with them if they do not feel like they are being heard. Support. Providing psychological and emotional support for workers helps them cope with the challenges of patient care. You could provide a safe, quiet room away from patients, implement a check-in process for workers who experience any work-related violence and aggression, and provide psychological support for workers. Training. Implement consistent work-related violence and aggression prevention training with new and existing staff.
This will equip staff with the skills needed to handle challenging situations, de-escalate conflicts, and recognise early signs of violence or aggression, and train them in ways to manage or act in the event those situations arise. These are just some ways you can implement work design in your workplace. Work design can also be used in a new hospital build or in an existing hospital. Next, let's take a look at how we would use work design for a new hospital build. Work design principles can be implemented during the design phase of a new hospital build, with architects and planners working hand in hand to create spaces that prioritise safety and efficiency. It starts with considering the work that will be done in the workplace and consulting with impacted workers from the very start. This may involve considering the layout and infrastructure. This could include designing spaces to minimise the risk of conflict, such as considering space in waiting areas and wards, having well-lit and wide corridors, ensuring safe areas or barriers are present where there is a greater risk of violence. Security staff are visible and located where they can quickly respond, and ensuring that staff have adequate visibility of their surroundings when they undertake work.
Technology integration. This includes incorporating security measures and reliable communication tools to enhance safety and coordination among staff, such as the effective use and maintenance of duress alarms, security cameras, and central security offices or hubs throughout the hospital. This will facilitate faster responses to incidents of violence and aggression. Another example could be safe rooms or auto-locking devices in wards where the risk of violence and aggression is high. Dedicated quiet areas. Building spaces that allow for quiet and calm for workers as well as patients and their families. Hospitals are busy and bustling with the constant sound of people and machines. This environment can place additional stress on people. Having a quiet space that has comfortable seating and noise control or suppression for workers will allow them to have their meal breaks in quiet and assist them in helping to manage their psychological health and well-being. When managing patients or their loved ones' emotional states, quiet areas may be able to reduce escalating behaviours, thus reducing risk to workers.
Let's now consider how work design may be used in an existing hospital environment. Through redesigning tasks and the physical environment in consultation with workers, we can enhance the health and safety of workers and patients alike. This could be done by reviewing the systems of work in place, by examining workers' roles to identify overlap or high job demands, and reorganising tasks to reduce stress or frustration workers may be experiencing. You should also consider the physical work environment, such as reconfiguring workstations to ensure that workers have adequate visibility of their surroundings, optimising traffic flow, improving lighting, or ensuring nurses' stations in higher-risk areas are safe spaces where workers can retreat to in the event of a violent or aggressive incident.
Communication enhancement. Improving and streamlining communication channels to avoid misunderstandings and facilitate teamwork. This could be simplifying processes or procedures, clarifying and streamlining reporting lines, reducing the number of communication channels, or setting up team-specific communication mechanisms.
Security changes or upgrades. Implementing better security measures to protect both staff and patients. This could include additional security guards in certain areas of the hospital where work-related violence and aggression risks are more likely to occur. Making security guards more visible and identifiable in the workplace to act as a behavioural deterrent, providing secure spaces for workers so that they can retreat to in the event of work-related violence and aggression. Other changes could include upgrading the duress alarm system, radios, or technology to enable a quick response. If the space allows, you could also consider installing security hubs throughout the hospital so security is dispersed effectively wherever the need arises. To help you better understand work design, you can visit the SafeWork New South Wales website and refer to our guide on designing work to manage psychosocial risks and download the Psychosocial Hazard Work Redesign tool. This tool can be used to develop the skills, competency, and confidence in using work design principles in preventing and managing psychosocial hazards. We have also produced a webinar on the tool that steps you through how to use the tool to prevent and manage work-related violence and aggression in your workplace.
Let's work together to create hospitals that prioritise the health and safety of everyone by embedding work design into the heart of healthcare. In the end, safer work leads to safer care.